Thanks very much, everyone, for coming in today. I'm joined here with PC Leader Patrick Brown, Nadia Alam, and Kulvinder Gill, two doctors in our province. Brought forth today to discuss not only the perpetual crisis our healthcare system is in today, but also what has been going on in the healthcare system over the last little while, in particular to our healthcare professionals. This government has attacked doctors publicly time and time again. We've seen other failures in the healthcare system causing stress on our healthcare professionals. The stem cell transplant breakdown in the healthcare system, which led to untimely wait times, people having to go to the United States for treatment, further stressed out our nurses, our RNs, RPNs, and our doctors. There's been a fear in our home care system that has been reported that people are afraid to speak out about the upcoming changes that the government is proposing in the next little while. Patients ended up being restrained on floors in our emergency departments. Imagine the stress that weighs upon our healthcare professionals who are trying their best to help these patients get better, to seek the care that they need. The stress levels are going beyond belief for our healthcare professionals, and the cuts in the healthcare system by this government is only cutting out services and making it worse for those to do their jobs on the front line. It's time this government makes some changes. It's time the government starts to listen to the frontline healthcare professionals that are affected by this. It's time that this government to properly fund the healthcare system and quit with the cuts. We called today earlier for Minister Hoskins to step aside and allow somebody in the cabinet to step forward and do the job that he is unable to do. I'd like to bring forward our leader, Patrick Brown, to say a few words.
Okay, well, thank you to Jeff Yurek, our health critic, who's doing such a terrific job advocating for patients, for physicians, for nurses, for healthcare practitioners in our province. I found it very interesting in question period today when we were demanding some accountability for the chaos in the healthcare system, that Premier Wynne would not stand in support of her Minister of Health. I think a recognition that these cuts are very unpopular in the province of Ontario, and there is real damage that's been inflicted upon the system, whether it's the 1,400 nurses that have been fired in the last year, the overcrowding in almost every hospital, at sick kids at Brampton, London, Hamilton, Ottawa, of the obstetrics unit in my own riding of Georgian Bay General, cuts to hospitals, huge cuts to hospitals, staff in North Bay, Peterborough, and in Whitby. Every region, every riding has been affected by this government's cuts to healthcare. Hospital budgets are stretched thin. They are unable to do what they need to care for patients. It means canceled appointments, surgeries, longer wait lists, less patient-centered care. And we've heard countless of tragic stories of how the province's current healthcare system has failed patients. This has happened under the management of Minister Eric Hoskins, under the oversight and guidance of Premier Kathleen Wynne. There is a reason the Toronto Sun referred to the Premier as Hacksaw Kathleen this past weekend in their weekend edition. Today we are joined by representatives and co-leaders of concerned Ontario doctors, Dr. Kulvinder Gill and Dr. Nadia Alam. They live the Liberal health cuts every single day. Ontario's physicians have been working without a contract for 2 years. And the past year alone, the government has unilaterally imposed $815 million in cuts to physician services, which means cuts to patients. Not only that, but our doctors have been the targets of attacks by this government. They have tried to demonize and divide these dedicated frontline staff, blaming anyone but themselves for their cuts. It is shameful. It is unacceptable. Concerned Ontario doctors have been surveying the physician community about the impact of the Liberal government's cuts have had on service delivery and operations. Their findings are startling. So on that note, I wanted to introduce Dr. Gill and Dr. Alam to share their findings, to share what we're seeing with healthcare in Ontario. And my advice to Premier Wynne is that rather than running ads saying you're doing a great job, vanity ads, it would be nice to see a government that actually focuses on patients, on physicians, on nurses, the people who are throwing their hearts into the job to care for Ontario's vulnerable. And I think you'll find the findings of Dr. Gill and Dr. Alam as interesting as both Jeff and myself have. Thank you for joining us today.
Good afternoon. The last time Concerned Ontario Doctors was here at Queen's Park was in October. Since then, everything we spoke about, Everything we were afraid of has come to pass. Our healthcare system is crumbling at the hands of the Ontario Liberals. This is a perfect storm of years of chronic underfunding to hospitals and escalating, reckless cuts to physician services, combined with an ever-growing and aging population requiring more and more complex care. At the center, it is our patients that are suffering and dying waiting for essential treatment. Treatment their taxpayer dollars fund. Treatment this Liberal government has an obligation to provide. Witnessing the consequences of this Liberal government's senseless actions has been utterly frightening. The cuts to physician services has resulted in community clinics struggling to stay afloat. Since October 1st, nearly 200 family doctors and specialists have been forced to lay off staff, reduce patient services, or close their clinics, impacting the direct access and care of nearly 200,000 patients. Now nearly 1 billion patients are without a family doctor. Ethically, with waitlists mounting to over 1 to 2 years for overworked specialists, they cannot accept new patient referrals as they are unable to see the patients in a timely manner. This is happening all across the province. In all specialties, from mental health and orthopedics to obstetrics and oncology, access to these essential services has been severely restricted because of provincial Liberals refuse to match funding to actual patient need. The consequences of this are dire. With nowhere else to go, the patients are flooding ERs and creating code gridlocks across the province. This is when patient care needs exceed hospital resources. The GTA has been overwhelmed with the sheer volume of patients. One example, since February, William Osler in Brampton has called code gridlock nearly 80 to 90% of the time. Doctors are told to, quote, find creative solutions and are pressured to discharge patients sooner by the hospital administrators. During such code gridlocks, elective procedures and surgeries are cancelled and patient stretchers are parked in hallway corridors. This is 2016. This should not be happening. Prominent hospitals in downtown Toronto, including Sunnybrook, University Health Network, St. Michael's, and Michael Garon, are now making alarming cuts to OR blocks. Hundreds of OR blocks at each site are permanently closed due to lack of funding. Surgical wait times will lengthen by 1 to 2 years because nearly 8,000 fewer surgeries will be performed each year. 8,000 fewer joint replacements, fewer kidney stone removals, fewer cataract surgeries, fewer heart valve replacements, fewer valvular bypasses, fewer spinal decompressions, and fewer carpal tunnel surgeries. 8,000 patients waiting in pain and suffering while Toronto's ORs sit empty. Nursing layoffs will follow. Highly qualified surgeons will leave the province. Out of the 13 graduating orthopedic residents at the University of Toronto this year alone, 12 are planning to leave Ontario. These cuts continue to affect the most vulnerable. Dying patients are being denied the care they so need and deserve. In Ontario, federal legislative changes will soon guarantee access to assisted death within 10 days. Assisted death will affect less than 3% of our population, while palliative care could benefit 100%. Currently, 70 to 80% of Ontarians are dying without access to quality palliative care. This is unethical. This is immoral. This is 2016. This should not be happening. Ontario's doctors demand that the Liberal government stop their reckless cuts to healthcare. Minister Hoskins has utterly failed at his portfolio. Concerned Ontario doctors calls for his immediate resignation. We need a health minister who is willing to work with Ontario's doctors to put an end to patient suffering and work towards creating a healthcare system that is sustainable and provides quality, timely care to essential services. Thank you.
Good morning. The Ontario Liberals are shortchanging the healthcare system and it's not just Concerned Ontario doctors saying so. A report last week by the Financial Accountability Office confirmed this. FAO calculations proved the government needs to invest 5.2% more in 2016 to maintain universal medical services. Instead, the Liberals capped investment at 1.8%, one-third of what's actually necessary. In fact, the Liberals have been shortchanging healthcare since 2012. So it doesn't matter what numbers the Liberals quote in their radio ads. It's just not enough, and they know it. With less coming in and more going out, inevitably, medical services are cut, staff are fired, clinics and hospitals are closing, and waitlists spiral out of control. Waitlists start when existing healthcare resources do not match existing patient need. Even with doctors working full out, serving patients above and beyond full capacity, wait times balloon to 1 year, 2, sometimes even 5. Many specialists cannot manage more than urgent referrals, let alone the non-urgent ones. This is the reality right now in hundreds of communities, including resource-rich areas like Toronto and Ottawa. Yet billions are wasted on failed projects like e-health and useless bureaucracy like the LHINs. Even the Auditor General herself slammed the Liberals for squandering taxpayer dollars. Faced with rising need, insufficient resources, and scandalous waste, frontline doctors are paddling like hell to stay afloat. Of 1,000 physicians surveyed by Concerned Ontario doctors, 3/4 said they were burned out. Not tired, not sad, but frankly burned out. Before the Liberals imposed their contract, only 9% felt moderate to high workplace stress. That figure has now skyrocketed to 75%. When asked why, 86% felt vilified by the Liberals. 60% felt medicine was dominated by irrational government policy. 41% were working harder without seeing better patient outcomes. 1/3 are planning to leave Ontario. Some even state they've regretted going into medicine at all. One doc wrote, "I now wish on a daily basis that I had a way out. I feel like I'm hitting my head against a brick wall. I just want to do my job." Another wrote, "As a trainee, I'm caught in the middle, wanting to provide good patient care, but prevented by the politics of budget cutbacks restricting hospital admissions." And finally, another wrote, "I start my day loving being a doctor, but almost every day ends with exhaustion, cynicism, and hatred of a job that is ruining me." This is how burnout starts: anxiety, depression, and compassion fatigue. Left unchecked, burnout escalates to substance abuse, medical errors, despair, and suicide. This is all the more alarming because the suicide rate among physicians is twice that of the general population. Healthcare is in crisis. We need a health minister who partners with doctors rather than unilaterally imposing contracts again and again, contracts that are unfair, unsustainable, and that undermine patient care. Thousands of frontline physicians have lost all faith in Eric Hoskins. They no longer trust his government, a government that spins rhetoric without conscience, that plays at semantics when they should be honest, that tweaks the numbers to mislead and misinform. We need fact, not fantasy, if we are to bail out the sinking life craft that is our healthcare system.
Thank you.
Thank you.
I should note MPP Bill Walker is with us as well today, our critic for long-term care. Any questions?
What makes you think that a new minister other than Eric Hoskins would do something to improve the situation of healthcare?
I think we're at a point right now where you have nurses, physicians who aren't even on talking terms with the Minister of Health. It is a toxic environment, and his approach to demonize physicians, to say that everything is right and that the patients who are pleading for help are wrong. It just is not helpful. We need a Minister of Health who's willing to have an honest assessment of the situation in Ontario and not live in a fantasy land. And I think a fresh start. I don't think anyone can say that it's positive for Ontario's healthcare system to have a situation where the Minister of Health is loathed by almost all the employees in every field of healthcare.
Would I add to that?
Yeah.
One of the things I would also mention, just to add to what Mr. Brown was saying about the toxic work environment, in the past year and a half of cuts and ongoing clinic closures, Eric Hoskins has yet to meet with one frontline physician from Concerned Ontario doctors. In the past year and a half, he has not met with one. Even though he's well aware of all of our findings, he still won't meet with us to talk about them. And that is what disappoints us the most of all. He's supposed to minister to the healthcare system, and he's failing at his job.
What's your take on the deferred maintenance costs, the NDP's FY request?
I would, Jeff may want to add in, I think it speaks to the chaos we're having in the healthcare system. I've been touring hospitals. I'm going to a hospital this afternoon, actually, in Scarborough. I was in Collingwood a week ago, and there are huge structural issues. There are huge infrastructure issues. And I know the government likes to ignore it, but it's part of a problem when the government's been asleep at the switch on healthcare. You're seeing healthcare diminished not only in deferred maintenance but in human resources, and I think it's the reason we saw that report saying that there was no proper planning for hospitals, no proper. The minister has no collection of data in terms of the cuts and what the cost has been.
For healthcare for a moment, if the PCs are elected in 2018, how much more will you spend on healthcare than currently?
I think the bigger picture on healthcare is this. We'd have a Minister of Health who meets with physicians and nurses, that all our resources will go towards frontline care. You hear stories about the government spending 39% of the healthcare budget on administration. You see the huge cost of the LHINs. I don't want more bloated administration. I want all those resources going to the front lines to help patients. And so yes, you'd see investments in healthcare, but you'd also see a better management of the system. Do I think with 140,000 patients a year, do we need to spend more in healthcare? Obviously you have to. You can't add 140,000 new patients a year and not have any accommodation for them like we have today. But I do think there is lots of opportunities for a much more efficient management of the healthcare system.
Sir, can you talk about one or two of those possibilities? Where is the government falling?
Well, I think one of the best examples is it used to be that the gold standard in administration was 5 or 6%, or even when it wasn't, it was 13%. To hear 39% being spent on administration in home care is astonishing. That's money that should be going towards people that are vulnerable, people that need health care. The fact that you've seen the administrations in healthcare, not just in home care but all across healthcare, increase while the front lines has been cut is not acceptable. You look at the LHINs. I was in Brampton with 100 doctors, and I asked how many of the physicians there see benefit from the LHINs, and no one put up their hand. It's about putting funds back to patients. I look at the ALC levels in hospitals, and the government doesn't like to talk about that because they've underfunded long-term care. You've got the average hospital 19-20% ALC, so people who are waiting for beds in long-term care at a much and a bed in a hospital is much more expensive than a bed in long-term care, which goes back to the fact there is no planning. There is no coordination in the healthcare system under Eric Hoskins. And I think if you had a better strategy around ALC beds, if you had a better strategy on preventative care, not cutting the physiotherapy that caused more people to use the hospitals, if you looked at a broader vision of healthcare, I think the province of Ontario would be a lot better off.
Thanks, everyone.